Dr. Sanda Moldovan is a biological dentist. She is a board-certified periodontist. She is certified nutrition expert and the host of the Holistic Dentistry Show. Welcome to the show, Sanda.
Thank you so much, George, for having me.
Yeah, excited to have you on. Tell us about your personal life, more about your work, and why you do what you do.
Well, I live in Los Angeles, California. I'm very passionate about a holistic lifestyle, and really my mission is to make biological dentistry mainstream. It's much needed compared to the traditional dentistry. And I have three dental offices here in Southern California, Beverly Hills, Newport Beach, and Encino.
Excellent.
What I do is I'm an integrative periodontist and I help people detoxify their mouths from microbes and metals for a healthier body.
In biological dentistry, biological dentist, is that you are a biological dentist, and I don't know what that is. So please tell me what that
Yeah.
is.
It's a good question because a lot of people don't know what that is. And what we do, we provide personalized dentistry to people that are in need of whole body health. And let's face it, I think pretty much everyone is in need of whole body health. And the big difference is we don't just treat the holes in the teeth, we look at the overall. We treat the whole body, not just a hole in the teeth.
Do we have lots of holes in our teeth?
Usually, those are referred to as cavities.
Ah.
And why do cavities form? It's not just, oh, eating too much sugar. Yes, but it's also the presence of bacteria. And actually, a lot of people might not know that cavities are the number one most preventable disease in children and adults.
Well, that certainly makes sense to me that were cavities a thing 100 years ago?
Exactly. If we look at not 100 years ago, but Weston Price actually did excellent research in the 1920s and 30s and showed that tribes in South America, for example, they had perfectly developed teeth, they didn't have crowding, they didn't have cavities. And he looked at the differences in the diet. And really, that's where a lot of our diseases, not just oral diseases, but systemic diseases come from. So he discovered that people that have more fiber in their diet, they have better jaw development, and also people that have, of course, less sugar, less processed foods, don't develop cavities. And what's interestingly enough, eating organ meats such as providing retinol, vitamin A, super, super important for preventing cavities.
Why is that? Oh, you mentioned because it's that vitamin mineral.
Yeah, it's everything that's needed to provide a healthy tooth. So when we get our teeth to develop, we don't just need the minerals. Yes, teeth are made a lot of minerals, but we need actually the retinol to help with that development. And why do people not get enough minerals, especially children today? We're seeing rampant cavities coming back. It has to do also with absorption of the nutrients. So it's not enough just to take them in, but do we actually absorb them? And what we're noticing, and more people have, and children have gut issues today, leaky gut, which leads to malabsorption. And essentially, if we don't get the minerals and the nutrients that we need in our body, then we're not going to have good development of teeth.
Which certainly makes sense. I mean, you tell me where I'm wrong because I'm wrong a lot, and I don't mind being told that I'm off base here. Um, but it strikes me that a common sense approach is a sound one. Don't eat a ton of sugar and a ton of processed foods. Eat healthy whole foods that are high in quality calories, like organ meats, things like that.
Mhm.
What uh what role, if any, does snacking play? And I don't know if people during that study, that time period, if they were constantly just snacking.
People were not snacking. That's a new thing. So the problem with snacking is not just for oral health, but also for gastrointestinal health. We need to give our digestion a break, and we need to give our oral bacteria a break from eating the food that we're putting inside our mouth because they do feed off the nutrients that we put inside our mouth. So snacking is not ideal. Um, And if we do snack on something, we should choose a whole food approach, such as, carrot sticks, celery sticks with hummus, like whole almonds, whole apple. Just have whole foods,
So not Cheetos, doctor.
not Cheetos, with
Ah.
artificial colorings. Yeah, exactly.
So you're gonna have to bear with me because I'm gonna bounce around a lot on you. Um, whether it's true or not that using hand sanitizer destroys the natural stuff going on in my hands, I'm not asking you that. That's just my perception. If I'm using mouthwash, is that carpet bombing and nuking the bacteria in my mouth?
Exactly. You're absolutely right about that. And I'm not a big fan of destroying the microbiome. We need our friendly bacteria, not just on our hands, but we need them in the mouth, especially. And I tell patients all the time, you're never going to win that battle of killing all microbes in our mouth, which are in the trillions. And what we do know of people that actually try that end up with a lot of ulcers in the mouth. Because when we don't have that protective layer of good bacteria, we can actually be more susceptible to cavities, be more susceptible to gum disease. So they do play a role there. So for that reason, home care is super important. So my recommendation for good home care is brush with calcium hydroxyapatite to help strengthen teeth. Natural paste, we don't need fluoride. Second, floss or water floss for those of you that don't like flossing. And third, pop in a chewable probiotic to nurture your oral microbiome.
The first one was calcium something.
Calcium hydroxyapatite, it's actually the same mineral that the outer layer of the teeth called the enamel is made out of.
Got
Mhm.
it. And so the point of that is to strengthen that, or is that possible?
Yeah, it's possible. So studies have shown that nanocalcium hydroxyapatite actually helps to fill in the pores of the enamel. So why would an enamel have pores, right? The outer layer of the tooth. Well, because of the diet, right? We eat, let's say, lemons and apples, which are good for us. But that acidity in contact with the enamel creates little porosities. How does a tooth bounce back? Usually through saliva. So saliva carries and bathes the teeth and mineralizes them. It usually takes about 30 minutes. But what we're noticing through salivary testing is that people today have more of an acidic environment in their mouth, kind of for hours than we used to have by eating just a more alkaline type of diet. So that's why the recommendation today, hey, let's try to maintain that enamel. So actually apply the calcium hydroxy apatite on the surface of the teeth through brushing. That's the easiest way to put it there.
Probably a good policy for me and everybody else not to drink soda, not to be consuming these foods that are destroying everything about me and certainly my mouth and my teeth. If I do, if I have a soda or I drink whatever, I'm eating something that's very acidic. Should I be brushing my teeth immediately thereafter? Should I be using mouthwash just to get rid of that, or should I give my mouth a chance just to fix it on its own?
That's a great question. Definitely don't brush right away because your enamel is now in the weakest form. So you can rinse with some water, just swish so that it kind of neutralizes that acidity. But wait 30 minutes so your enamel had a chance to mineralize before you actually brush your teeth. Because if we brush the enamel in an acidic environment when it's already at its weakest, that's when it starts to wear off more.
Hmm.
Mhm.
I think I've probably been guilty of that. I'm just going to brush aggressively to get everything off my teeth. You've probably never seen that before.
Yeah.
Like, no, everybody does that.
Oh yeah.
Everybody does that all the time, George.
Of course. Yeah, that's right. Yeah.
Is alkaline water a good thing to drink?
Yeah, definitely. And to your point with the sodas, George, I'm not a big fan of sodas. And I know nowadays, we have all these probiotic drinks and all this, which are awesome, right? Because they're healthier carbonated drinks, but they're still acidic.
Hmm.
So just because they have a health benefit, keep in mind the acidity coming in contact with the teeth should be minimized. Even for people that are drinking lemon water, like I've seen patients that basically came in and they had so much wear on the teeth, and we're like, what is this wear for? They're in their 40s. Oh, I drink lemon water every day. And how do you drink it? Oh, I just sip it a little bit at a time. I love lemon water. And I recommend people either drink it in the morning, not sip it throughout the day. If you're going to sip it throughout the day, at least use a straw. But not good to have that acidity in contact with teeth all the time because they will wear down faster.
So I'm a fan of going to first principles on things. What are some of the first principles when it comes to oral health? Certainly, if I have metal fillings, I need to get rid of those or have those checked.
Yeah, you're absolutely right. So I have to tell you a story, my story actually. That's what drove me into becoming a biological dentist and periodontist. I grew up in Romania. So by the age of 14, I had 16 large mercury fillings in my mouth, otherwise called,
16.
yes, 16. And whenever I opened my mouth, you could see all this metal in the back. So I decided when I went to residency at UCLA that, I'm in LA, I should get rid of them. So I had my friend in dental school remove them all. And I started getting sick shortly thereafter. I had blurry vision, I had headaches, I didn't feel well, I didn't have enough energy, and I honestly didn't know what was wrong with me until I met a naturopath. I went to get some testing done, and my mercury was off the charts, the mercury in my blood. And I asked her, how did I get this toxicity? Well, she said, from removing your mercury fillings. And I was so upset because no one in dental school ever mentioned that mercury fillings or amalgams can be toxic to me. No, and dental students remove and place mercury fillings even up to today. It's part of the requirement in the curriculum. And nobody mentions to the students, hey, by the way, if you're inhaling the vapors of the mercury, especially as we cut into it, it's gonna create toxicity in your body. That discussion never happened. So that's what drove me to where I'm today and all the efforts that I'm putting into awareness of people knowing that, yes, if you're going to remove the mercury fillings is a good thing. Just make sure you go do it safely. Not like me, I didn't know how to remove it safely. So I ended up with all the mercury toxicity.
You just ask your buddy to pull them out.
I did.
Sure.
I'm like, I want white teeth.
You
That's
bet I
all.
can. That's not funny at all, but it's kind of funny.
Yeah, yeah. So anyway, I'm sure like me, there's a lot of other people out there who are like, why am I feeling sick? Well, maybe because the mercury levels are very high.
And you look like a really young person. How prevalent are mercury fillings?
Millions of Americans have mercury fillings and all over the world. So mercury is still being placed in this country in children,
They're
uh,
still doing it?
still to today.
How
Europe,
why are they doing that?
it's a political issue at
Oh,
the ADA. I think the ADA is scared to now all of a sudden come out and say, oh, the things that I endorsed for hundreds, 100 years now is toxic. Even though we have studies, we have lots of studies in animals and people that toxicity actually happens. We have a sheep study. They placed these mercury fillings in the sheep. A month later, they sacrificed the sheep, and it was mercury everywhere in the lungs, in the liver, in the brain. So it doesn't stay in the mouth. In Europe, they banned mercury fillings and all kinds of mercury starting January 1st of this year. But we're always behind the Europeans in terms of the, yeah, same with fluoride, right? And in Europe, they don't use fluoride in the water. We still do. So we're slower, but hopefully it's coming.
not interested in owning our mistakes.
Wow.
So in a lot of ways, well, I don't know if that's correct or not, that the mouth is the canary in the coal mine, or it is it is a critical component to our overall health and probably overlooked.
Yes, I agree with that statement. Definitely overlooked. A lot of people that come to me and the way I work with patients is they usually get referred by their physician, usually functional medicine, because they're not feeling well. They have brain fog, they have inflammation, and the physician, the integrative doctor says, well, I don't see anything in your body, but let me refer you to the dentist. Maybe they see something in the jaw. So, what we do, we take this three-dimensional x ray of the mouth And we look to see, is there kind of bacteria that's stuck in the bone from the root canal teeth? Are there microbes there that are causing the fatigue or the brain fog? Is there mercury there that's also causing this? So we're just basically taking all this out so that people can feel better. And typically that's what we're seeing. Like after we detoxify the mouth, people feel better.
So detoxify the mouth. So from a root canal, from fillings, from stuff, there's bacteria that has found a home in our mouth, but it is possible to clean and get rid of that bacteria and it doesn't come back so long as I'm not repeating the same behavior.
Absolutely. Yep. Absolutely right. We have a lot of good technology today. Even when it comes to something like bleeding gums, some people think, oh, my gums are bleeding. So what? It's normal. 80% of people in the United States actually have some form of gum disease or bleeding gums. And most people actually don't reach out for treatment until the disease is more advanced. Um, we don't relate mouth bleeding to, let's say, your hand bleeding. If your hand was bleeding every day, I'm sure it'd be more alarming,
Ah,
right? But if you're flossing and it's bleeding, people are like, yeah, whatever, it's bleeding when I'm flossing. It's okay, it doesn't hurt. But it is a problem because every time our gums bleed, it's a sign, number one. Secondly, the bacteria travels. It catches a ride in our blood vessels and it goes places. How do we know? We know that gum disease increases the risks of heart attacks and strokes. And now we have pancreatic cancer. There was an article that was just written. So it travels. Our immune system is not perfect. It can scavenge it occasionally, but not always. So super important to pay attention to oral signs such as, wear down of enamel, bleeding gums, anything that feels like it's a soreness. And I recommend everyone just do a self-exam at home at first, kind of look at the gums. Do you see any black spots, any red spots? Look at your tongue. Is it red? Is it white? Should be a nice pink color. These are all signs that something must be going on if signs are off.
80% of Americans have bleeding gums, which does not on its own mean that they're not healthy, but it's warning signs that there potentially could be greater issues at play. And the consequences or the potential for more harm is a lot greater than we maybe think. And I'm sure that because it's 80%, which is a huge number, that these are people that have chosen to leave well enough alone and to brush it under the rug and to dismiss it because maybe they know they're eating crappy foods, but they don't want to stop doing that. Now I'm reading people's minds, but I'm just sort of guessing at some of the reasons that people would not address this. But
Mhm.
the potential, but it could be catastrophic and it could be costing them quality of life and it could be way worse than that.
Yes, you're right. And I feel, and I always say this, the simpler the problem, the easier the solution. That goes with everything, not just oral health. But if we see a problem, the more we let it linger, the more complicated it gets to fix.
Where else does that show up in life? Oh, yeah, everywhere,
Everywhere. Yeah.
everywhere.
And I certainly have been guilty of that as well.
Not me. I never do stuff like that. No, I do stuff like that all the time. All the time. All right, so let's get back to those first principles, which you already gave it, which you already talked about. Reduce sugar, reduce processed foods, reduce snacking, particularly if it is of more processed foods, and go to more whole foods. Focus on really high nutritious foods that will hopefully have a better chance of absorbing into our bodies. Do not ignore discomfort, bleeding gums, anything that's in the mouth. Don't brush immediately after you drink lemon water or have a soda. Give your mouth a chance. What
Mhm.
else?
I think one of the important things is, we see an epidemic of stress. And especially in the last 3, 4 years, we see more and more people coming in with jaw pain from clenching and grinding. So, harder problem to fix. So my recommendation is really if you're starting to get headaches here on the side of the face or even temporal headaches, um, check to see if you're clenching. Most people will say, yes, I wake up with a really sore jaw. Okay, that's definitely a sign. And some people don't know it. Like if we actually massage the side muscles here, just right by the ears, if they feel really, really like hard, rock hard, it means that, we've been working them out at night. And harder problem to treat, but super important to protect your teeth. As we live longer, our life expectation is longer. We want to protect them. Traditionally, most dentists do night guards. It also goes deeper than that, finding, some mindfulness practices to help to relax, especially at night. It comes to like, evening, like sleep hygiene. Um, and maybe listening to some guided meditation. For those of you that are not crazy about meditation, guided meditation works great for me. It keeps my mind from wandering. Magnesium, something to a muscle relaxant, super, super important. There's also exercises for the jaw just to help them relax right before you go to sleep or even in the morning if it does feel sore. So we always try to find like a holistic approach, not just a night guard. Although night guard, I always say it's the best insurance policy not to break your teeth if you're a grinder.
Yeah, I certainly ground my teeth and maybe still do, but really badly for a long time and wore down a lot of them, so I can certainly speak to that. What was the case for fluoride? Why was it put in the water originally?
That's a great topic. And our association, IAOMT, just won the case against fluoride, meaning we want it out of the water because it really doesn't do anything. And there's no informed consent. So looking back at fluoride, what is fluoride? It's actually a drug. It's also a pesticide, is used in the field. And a great documentary called Fluoride Gate about how fluoride ended up in the water. And it really ended up in the water as an agricultural byproduct. They just didn't know what to do with it. So we dumped it in the water. Recently, Utah and Florida were the two states just this year that have decided to take fluoride out of the water completely. In the dental office, we are required to give people an informed consent, meaning, okay, I'm going to do this procedure on you. This is the side effects if you're going to do this procedure. This, and that. When somebody drinks water, nobody tells them what the fluoride will do to their body. And we have studies to show that in areas where there's a higher concentration of fluoride in the water, the children between ages fifth and eighth grade have a lower IQ. So we know it influences children. So there's absolutely no reason for fluoride to be in the water. And there's no studies to show that, fluoride actually helps to keep your teeth longer.
Unbelievable.
Yeah. And I'm glad that we're finally at least getting to a point where we can talk about it and we're able to get it out of the water.
Part of me thinks that where I grew up had a lot of fluoride in the water, Sanda.
You're funny.
Somebody's gonna pay for this. Somebody's gonna pay for this. But nobody's gonna pay for it, Sanda. That's neither here nor there.
Yeah. Yeah, that's true.
Well, Sanda, thank you so much for coming on. Where can people learn more about you? What's the best way for people to engage with you?
You can follow me on Instagram at Dr. Sanda, DrSanda. You can go to our practice website, beverlyhillsdentalhealth.com. And of course, I welcome you if you want to learn more about oral health at the Holistic Dentistry Show podcast.
Excellent. Well, if you enjoyed as much as I did, show Dr. Sanda your appreciation. Share today's show with a friend who also appreciates good ideas. Find her on Instagram under Dr. Sanda. It's Sanda. And go to Beverly Hills Dentistry. What is the
Yeah.
website?
Beverly Hills Dental Health.
BeverlyHillsDentalHealth.com. And then the Holistic Dentistry Show podcast. And let's be more proactive and take control of our oral health. That will lead to greater health in general. And let's all get pitchforks and torches and go down to the place where they invented fluoride and
Yes.
demand justice. Just kidding. Thanks.
Sounds good, George.
Thanks again, Dr. Sanda.
Thank you so much for having me.
Until next time, remember, do your part by doing your best.